Hello and good morning, everyone. Welcome to the Center for Nonprofit Management's Community Conversation on today, April 8th, 2022. We are excited to have two of our community leaders with us, Ms. Ashley Brooke James and Brian Marshall, Brian Marshall, here to continue a conversation that we have had over the last couple of months. So we have convenings here at the Center for Nonprofit Management where we amplify the voices of Black and Brown and Hispanic and Native and Asian and people with exceptional living in our spaces, those that are nonprofit led, and also our community stakeholders and partners and friends that come from many spaces. So we're asking you to check in today a couple of ways. Number one, who you are, what organization you're representing, or if you're here representing yourself, we'd like for you to check in with that. And then Ashley Brooke James is going to open us up with a few things, but I would like to open the meeting in a way that is incredibly intentional for us. I want to thank all of you. And as the Director of Community Impact and Equity Initiatives here at the Center for Nonprofit Management, I want to acknowledge my gratitude for being able to live and work on the sacred ground belonging to our Native ancestors here in the state of Tennessee from the Cherokee Nation, in addition to Chickasaw, Creek, Natchez, Shawnee, and Yuchi. May our work in this space demonstrate a commitment to justice, equity, truth, and peacemaking through shared storytelling and rituals from my Indigenous and African roots and the roots that you also represent here in community. We at C&M are committed to equity, inclusion, justice, and belongingness. And we want to thank our consultants, our researchers, and curators from the people represented here today, so that's all of you, for being able to bring us not only knowledge, but to learn, unlearn, and relearn some things around health and wellness, and to reverse the curse of systemic oppression and racism that has prevented liberation of marginalized people around the world. We thank you for being here today. Ashley, I'm going to go ahead and turn it over to you for our next activity.
Hello and good morning, everyone. Thank you all for, I'm going to say, being intentional and making time and space to enhance and share what we know about health and wellness, and giving Brian and I the opportunity to share some things that we like to speak on, some of our experiences. So again, we thank you. I would like to start today out by having everyone just do some breathing techniques to kind of reset ourselves from whatever we're coming off of, if we're coming from work, or if we've, just come from lunch or whatever, just giving us an opportunity to reset and ground ourselves. So if everyone could just, wherever you are, if you're in a chair, just sit back, relax, just take this opportunity just to relax your body. And everybody just take a big breath in through the nose. And I want you to imagine filling up your lungs, your chest like a balloon with air. And then sigh it out, exhale, let it go. It's Friday, letting go. Again, big, beautiful inhale in through the nose, fill up the lungs, the chest with air. And exhale, sigh it out, let it go. One more, I want you to take the biggest, fullest inhale that you've taken all morning long, and I want you to hold it at the top. And then on the exhale, we release, we let go of any and all things that aren't serving us in this moment. And so I want us to take this opportunity to check in with the body, to check in with the breath, So bringing our attention to the soles of our feet, our ankles, our toes. Take a big breath in. And exhale, allowing the body to soften. Relaxing the legs. Letting go of any tension in the knees. And allowing the thighs to melt into the chair. And so when we inhale, we're going to fill up our belly, our ribs, our chest with air. And then exhale. The shoulders, the arms, the wrists, the hands, the fingers all soften. We relax the shoulders. Maybe we drop the chin to the chest and let the head just roll from side to side. Being gentle, not rushing ourselves, and maybe that side to side starts to create these circles. So we carry a lot of extra tension and stress in our neck and our shoulders. And maybe you even hover over some areas that feel good to you, making a complete circle in one direction and then the other. Take a big breath in. On the exhale, we bring the head back to center. Again, we allow our mind to direct the breath as we breathe into the belly, to the ribs, to the chest. Exhale, chest, ribs, belly. Last round, breathing into the belly, to the ribs, to the chest. Exhale, chest, ribs, belly. Take a big, beautiful, full inhale in. And exhale, side out. Last big breath. The biggest, fullest inhale you've taken all morning long. Taking one more sip of air and hold. And then we exhale, we release. We're choosing to let go of all and anything that does not serve us in this moment. Soft inhale in. Long exhale out. And maybe you drop the chin to the chest and start to blink the eyes open. And then exhale brings the head back to center. And so I like to always say after I do breathing techniques, just to always remember my voice whenever you feel like you just need to take a moment and just, so thank you.
Thank you so much, Ashley Brooke James. That was so worth it. And as you can tell, today we are taking a deeper dive into health and wellness. So as we get started, what I'd like to do is to have our two amazing panelists and facilitators for this next part of our journey to tell us about themselves. And then I'll give you the outline for today. We're going to open after their introductions with a quick poll just to see where you are and take a pulse. Then I will move into questions where we will use the tool of storytelling through their lenses to talk about some things specifically within the health space and the wellness space. And then you will get a chance to take a break, process, come back and get ready for what we will experience as the bystander exercise. So today's conversation requires your entire body, which is why Ashley had us do this to begin with. So then we will end our day with next steps and some things that we can do to move forward on our journey to justice. So I'll turn it over to you both. Ashley, if you could go ahead and introduce who you are and what you do first, and then we'll end with Brian, and then I'll immediately move into questions and the poll.
Yes, thank you, Dawn. My name is Ashley Burke James. I am one of the co-founders of Triluna Wellness. We are a company focused on stress management and burnout prevention. Both my business partner and I got into this after leaving our corporate jobs in 2017 due to burnout. We didn't have language for it then, but we all know after going through what we've experienced the past 2 years, now we have language to put towards what we have been experiencing.
Yes,
Okay.
Dr. Marshall.
Okay, good. Hello, everybody. I am Brian Marshall, operating several different roles. I am the founder of Mash Up Nashville, which is a nonprofit organization that aims to address health disparities and social injustices of Black, gay, trans, lesbian people. And I also have an opportunity to work at Vanderbilt University Medical Center as a senior program manager, where I do a lot of work around anti-racism, health equity, and yes, helping bridging gaps between different communities in order to have important conversations to change cultures, if you would. So, yeah.
Excellent, excellent. So now I'm going to launch a poll and ask you to answer this poll. We'll just have it open for a minute. Just kind of want to see where we are as a committee here. So let me get to my polls and let me launch it. We can take just a minute to answer the question, what is the largest health and wellness issue facing our community today? Is it food insecurities, access to health care and wellness options, a lack of education or options in education, systemic racism and biases, or all of the above?
Mm-hmm.
There will be no score. We're just going to keep score here. So we're going to end this poll here in just a second. We're just going to ask everybody to come on in. We got about 64% of you. Oh, okay. All right. So got a little bit going once, going twice, and done. And we're going to share these results. Does everyone see the results?
Mm-hmm.
All right. Now I want to ask our participants, anyone want to come off mute and have a brief conversation about why you chose the option that you chose? But 69% of us say all of the above. What is this all about?
I will, Dawn. This is Felicia. There is someone stopping by my office every day with food insecurities. So that means they're not taking care of themselves any other way. I mean, they're not thinking about the medical part if they get sick. So I'll just leave it there. All of the above.
Excellent. Thank you, Felicia. Someone else want to jump in?
This is Sharon. As a certified navigator, helping people to access health insurance through the Affordable Care Act, and being in a state that did not expand Medicaid, I sit with so many people that are not able to access it because they don't fit in a category. And you know, when you're not well, it affects every other part of your life. When you cannot address those basic needs of diabetes or, you know, mental health services, there are only so many safety nets in the community. And I just feel like the lack of access to quality, affordable health care is huge. And that's what I see in my work every day.
Excellent, excellent. We have time for one more. Anyone else want to jump in? All right, well, Ashley or,
Well, I was gonna say, if no one wanted to jump in, one of the things that, I mean, I'm definitely all the above, because I think we all can kind of speak in certain areas. But I want to talk about the lack of education option, because I feel like nobody voted for that. I feel as though it's a big part of that as well. You know, a lot of people are afraid to try to learn how to get access because they don't know where to begin, and our lack of not knowing hinders us from being able to take the next steps. I also feel in this area, you know, we as a culture, as like black and brown people, we haven't always, it was just until recently that we have started putting our mental health on the forefront. And that was because we didn't know how to identify it, right? We didn't have the education to support that. So all these areas, I think I could give bullet points on all of them, but because no one voted for that, I wanted to bring, you know, my thoughts and awareness around that.
all right, thank you so much. So I definitely want to say this is why we're here. There's so many things. I was looking around the room and noticing the different places that all of you are playing. I appreciate you for spending time with us today. And hopefully by the end of our 2 hours together, that we will come up with a way that we within our spaces and we as a collective community can begin some work. There are several things that the Center for Nonprofit Management, many of you, you know, Brian and his organization, Ashley and her organization, that we're doing to start to chip away at a lot of what we just shared. So I now want to take you into some questions. Let's go ahead and just kick this off. So we're really going to speak from a lived and learned experiences standpoint. All of you who are here, regardless of all of your many identities, you have a voice. We want to hear it. And we in this space have courageous conversations that are necessary. So I want to just begin, you know, I want to start with one question for you, Ashley. How can we take care of ourselves as leaders and servants in a system filled with so many opportunities for change?
I think the key word there is change, right? Like, we first have to be open to the change as a whole. We all know the way that we work and the way that we conduct our lives have changed a lot. And I feel like when it comes to our health, we have to be open to understand, especially our wellness. I'll speak from a wellness perspective, but like some of the things that you were doing post-pandemic might not be working for you now. Maybe I think it is time for us to like kind of slow down and adapt and be intentional of the way that we care for ourselves. I'll take myself for an example. I am a certified yoga instructor. Post-pandemic, I did yoga a lot. During the pandemic, not as much. I feel like it was, my body was need of something else. I wanted to be in nature. I wanted to walk. I was adapting to not my normal routines of what I was doing. Even, you know, the way we all were eating, it changed, right? We were at home and, you know, the world made us feel like we should be working out, we should be doing this, when all we really wanted to do is eat cookies and binge watch TV, because that was the season that we're in. And I feel like when we talk about like the adaptation of change, the past 2 years, we have been in such a survival mode. We have, if we're talking like parts of the nervous system, we've been in that sympathetic nervous system, and we have to work our way back and ease our way back. And one thing I like to always mention is getting ourselves back to the basics. Getting back to the basics of things, not feeling like you have to rush to like get back into life the way it used to be, but slowing down and giving yourself, when we talked about, a lot of people talked about giving yourself grace. during the pandemic, I think that that's important now. I think it's more important than it was ever before because, again, everything is changing and we have to properly give ourselves the space to understand what we need that makes us feel good to nurture ourselves first. So then we can adapt to the people around us and we can support them the best ways.
Excellent. Dr. Marshall, would you like to add to that? And I do have another follow-on question. Okay, no worries. So we think about all the things that Ashley just shared. How many of you in the chat take care of yourselves and do something for yourselves at least weekly? If you do it, type yes in the chat right now. If you're one who actively does self-care every week, I'm not talking, this is, let's be honest, every week you do something for yourself, I want to see you put it in there.
Can I just add this? When we
Yes.
talk about self-care, right? Your self-care, when we think about wellness, I think we need to start thinking about more on a bio-individuality type spectrum, right? Like somebody's wellness may look different. This week, my wellness, I've literally laid in the floor a couple of times and just had 5 breaths, and that's what it's looked like for me. And maybe next week, it might be bubble baths and facials, but we have to understand that it's gonna change and it doesn't have to be what the world has put out. It could be every morning before you had coffee, you wanted to drink a cup of water.
Absolutely. Ashley, I'm glad you brought that up because many of us here, and I'm looking in the chat, Felicia, is it Jenny? Said almost. I appreciate that because we want to know that it's fluid. It changes.
Yeah.
I had a stroke 6 months ago, so I can't go run like I did before, but now I've incorporated yoga. So some of Ashley's work is now in my life. So I thank you who have checked in. And those of you who did not get a chance to answer, I want to challenge you to find some way to celebrate you over the weekend. Okay. Now, Dr. Marshall, your
Yes.
mic is up. Can you go ahead and chime in? What are some ways that we can take care of ourselves as leaders in this system so full of opportunities?
Yes, let me just first start off by just even acknowledging the fact that we need to take care of ourselves. I think a lot of times we forget that aspect of it. And I'm glad you brought up burnout. I actually did a presentation yesterday for the Tennessee Department of Health for HIV/AIDS about burnout, and didn't even realize, taking it back to that presentation was actually birthed through my dissertation I did for my doctoral dissertation, because I was experiencing my own burnout. And when they had asked me to do the presentation, I didn't even realize at that time that I wasn't even taking care of my own self. And what I realized is, and I'm gonna get to the answer, but I wanted to kind of walk this through. What I realized that is when we don't take care of ourselves as leaders, it affects and trickles down to people around us. It affects and trickles down to the most important people are in our clients. And so if we're not well, if we're not figuring out different kind of ways as leaders and servants, I'm so glad you used that word because I'm like serving more than I like leader. If we don't take time to learn and figure out different things to address our own needs, we will not be effective as leaders. We will not be effective leaders. We will not be effective leaders. And so what I have tried to do is find different things that I haven't done. Actually, last year was the first time I tried yoga. And I was like, oh, this is what people been doing all the time. And so I guess the first answer would be try something maybe you haven't done before. We talk about access to different health services and different things that people may have barriers to accessing. But I also was thinking about, a park that has a trail. Every morning when I was experiencing burnout or when I realized I needed to do something to take care of myself and I didn't have enough time to, make an appointment or to have I didn't have anybody to talk to, I would go to a trail and just walk around the trail every morning. And just that 30 minutes of walking around the trail, maybe it wasn't a whole mile, it may be just a few minutes, but I just needed to get out there and walk with my dog maybe once or twice. But that moment of just centering myself was so impactful to get my day started. And so basically all I'm trying to say is, number one, understand that it is important to take care of yourself. If you don't take care of yourself, it will have adverse effects. Number three, figure out different ways that you can address your mental health, even, including ensuring that you're reaching out to people like Ashley and others who are here to help us get ourselves together.
Absolutely. Thank you so much. So now we're going to go ahead and dig into this, since we're talking post-pandemic and all of us on this call were impacted by the pandemic. I wanted to dig into where these health disparities really resonate within our communities of color. So I want to take you on a little journey, and what we will do is this entire conversation today is being recorded. Thanks to Abby Janice, who is here. She is on the team, what we call Team Equity. And we will also have resources for you. I will be dropping them in the chat, but they will also be included in your recording email that you get. And I want to talk to us about the greatest challenges facing our communities, especially communities of color post-pandemic. How is this mental health and everything else really amplified in communities of color, and what are the trends that you have seen and the things that we need to address immediately? I'll start with you, Dr. Marshall.
Ask me the question one more time, because I feel like this was a really important question. I want to make sure I get this answer correct.
Yes. Okay. Post-pandemic, we've seen a lot of health and wellness opportunities.
Yes.
This is amplified in the minority community. What are the trends that you see, and what are the things we need to address immediately? And I'm going to drop some links in here for those of you who are going to keep up with it. Yeah.
So, I think that right now we are still in the pandemic, but also coming out the pandemic and seeing what that looks like. I would say, for instance, like, there are different organizations that work particularly with clients, and from the pandemic have had to work from home, which shifted how they experience clients. It shifted how much interaction they had with clients, and it limited somewhat. This may not be for all people on this call, because I know that depending on what area you work in, there may be some telehealth, and telehealth has been beneficial. You may have seen in your organization an increase in participation, attendance, or adherence, depending on where you work, depending on the work environment. But a lot of what I've seen, particularly with clients from minoritized groups during this time, is that if there is an instance where clients are able to come in and get, that meaningful time with either your life coach or meaningful time with your case manager, the pandemic through virtual means has taken away from that. And so, we still make our appointments with the clients. We still are able to do what we need to do with the client to check mark of our job roles and responsibilities, but are we still building those meaningful relationships with those clients to where, beyond us just check marking off, oh yeah, they made their appointment, oh, I talked to them, oh, they got what they needed, and oh yes, I'm meeting my metrics for either my grant or whatever I'm required to do from my supervisor. Coming out of the pandemic, what does that look like? Are we listening? Are we talking to the voices of minoritized groups who may be our clients, and asking them what is the need now post-pandemic? Are we getting their feedback on how we should be operating since we have gotten so comfortable, in this space of being from home and navigating working with clients from home? And I know that maybe it's depending on who I haven't gone through the chat and see all the different organizations, but I don't know how you all operate if we've gone back to clients coming in person. But I know a lot of organizations that still are operating virtually with clients. And so I think one of the things that we need to do is find a way to listen to the voices of our clients and seeing how we can have an impact, seeing if there's some things that we need to go back to. And of course, understanding the guidelines, although I'm seeing a lot of people not wearing masks and stuff now, I guess. Things are getting better since the Omicron. But we need to ensure that we are truly building those relationships. I see those and listen to the voices of our client. Oh, they're just quoting me. Yes, I like that. Thank you. How do we help navigate that? Relationship building is crucial in our communities of color. What does that look like? How are we asking them for their needs? That can even go along with doing a focus group. So asking clients, telling clients, we want to hear your voices. And guess what that does? That number one lets them know that they're valued, that you even want to hear their voices. And maybe providing an incentive for them to lend their voices that in turns will give you the information that you need, and also giving them an opportunity to say thank you for hearing your voice. But that information, that input that you will get will help shape what that looks like, instead of us thinking for ourselves, oh, we're going to do this and we think this will be best for the client. Ashley, do you have anything to input? I'm trying to read these comments. The comments are going. I'm like trying to follow the comments.
I'm reading them, but you're right on track. I mean, because that's what we as TriLuna try to curate for our clients, right? We go into these spaces, we create an opportunity where voices can be heard, to leaders, to like everyone in the organization. I will add this piece. One of the trends, if we want to talk trend wise, that I'm seeing, I feel like for the first time that I've been alive, I'm 40 years old. So I feel like for the first time, and I'm speaking for myself too, that we people of color are allowing ourselves to be a lot more vulnerable, right? Like we are we're putting out how we feel, where before, post-pandemic, that wasn't the case. That wasn't the case at all. And I feel because we have influencers, like people in the sport, like in NFL, are allowing our men to be, vulnerable. We have representation in the LGBTQIA community that are using their voices to bring this vulnerability in these spaces where before we would just kind of sit and be quiet. But now people are creating these spaces that allow us to feel safe, number one, that allow us to be vulnerable. So.
Yeah, absolutely. Ashley and Dr. Marshall, that was great. I want to highlight a note from Megan here in the chat. She says, I love companies like POSIP that help people have voices in education. I feel like it's been a huge value to our schools. And you know what? I thank you for putting that in. If those of you who are in our greater community have resources and know of some good people, let's go ahead and pop it in there, because this chat will also be a part of that information that you get. Because we do, and I know Ashley and Dr. Marshall feel the same way, we like to support people who are also doing the work. So let's be real honest about that. So getting into honesty and flipping it back to the wellness side, we know that representation is very important, especially in communities of color. Even in our classrooms, Megan, when a student has a teacher that reflects some of their identities, it makes the world of difference, right? So Ashley, I want to ask you, tell us about your experience being a Black woman in the yoga and the wellness side, and why that representation is so important.
Well, I actually found yoga through, I had chronic migraines and due to burnout. And that was my body responding to me, telling me like, you got to find something, right? And I wanted to go a holistic way because I tried the medicines and it didn't help. And so I found yoga, and I first found yoga online because at that time, Nashville was very hot yoga focused, and hot yoga was the last thing I was thinking about doing when I'm having these crushing migraines. And so I found Yoga with Adriene online, and I fell in love, and it was like, this is what I've been in search for. Like, this is, not only is it helping me physically, but it's bringing this this peace and calmness into my life that I had never experienced, because I did sales before. Before Triluna, I was in a high sales position and I traveled a lot. And a lot of these migraines came from that. When I started going into yoga spaces, I was probably always the only one, and still to this day. A lot of times when I walk into these spaces, I was the only person. And the first thing that I would always think is, well, if I'm the only one, no one in the Black and brown communities have anyone to see to represent that this spaces are for us too. And so my love for yoga became more of a love for, let me be that representation. Let me be let me get into these spaces to show the people in my communities that this is made just for us. As a matter of fact, it was created by us, but that got lost, in history. When we give thanks and we give honor, when we talk about that in yoga, we have to give thanks to the creators. But Brian, something that you said earlier, you was like, I had never done yoga, and I immediately thought it was probably because you never saw anyone that looked like you to, do yoga. So that's why it's important for me outside of my school. I am a middle school wellness teacher at Intrepid College Prep. It's a majority Black and brown school. And I wanted to be in that space intentionally because I wanted these young children to see representation of what it looked like to take care of our mental well-being. I've had multiple yoga certifications, and I've been the only one in all of my certifications. But I knew that I needed to be that in that time to open up opportunities. So I'm involved I work with a local studio with their yoga teacher training. And this last one that I did, I walked into this space and it was 3 Black, beautiful souls in this room. And it did my heart. Like it just made me feel so good, because I remember when I was in that space, I didn't have anybody else, and the fact that they had me to see, we can take this to another level because we've never really seen this before. And where I'm getting to is that one of those beautiful souls that was in that training was Don's daughter NC. And so she thanked me, and that's the greatest achievement that I can say, is being in this wellness space and being of representation, because I wanted to do just that. I wanted to show the people who look like me that this space, we create space for ourselves in here, and we can go far with it. So I kind of got on a tangent, but.
Hey, I appreciate that. Thank you for answering. And yes, my daughter found yoga as a means of, and a way for her to deal with her mental health, because the pandemic impacted her in such a profound way that she actually left college in California. So this is her new thing. So she's an entrepreneur like her mom, which I'm actually proud about that. So next question before we move into our first break. Let me get to my question. See, I try not to be off cuff. So this one I will put out to both of you. And I've also added in the chat the diversity and inclusion deck from Triluna. It is awesome. Be sure to download that, share it, and they will be available. We'll make sure that we include their information so you can connect with them after this. All right, so the next question I want to ask before we move into a break, what advice do you have for leaders in nonprofits, corporations, education, and government segments about how to provide an inclusive and healthy workplace for a person who may be in person, remote, or hybrid? So I want you to pull from your health and wellness brains and answer that. What advice do you have for us as leaders navigating this space?
I'd like to first start off by saying that as leaders and working with organizations and talking to leaders, I think that people need to learn compassion. And I know that that's kind of like compassion, but it's true. A lot of times, like when I'm speaking with organizations about the benefits of why Triluna and other services like ours are important, you know, they don't see the value because they can't see that immediate return on investment. But we have to understand that our mental health, we're not going to see that. And so I think we have to reframe the way that we like look at health and wellness overall and prioritize that at the top now. Where before it was like, you know, we'll give you these days and, you know, we'll give you vacation days and you use them, but people feel bad for using them. But I think leaders, as leaders, we all need to be open and have a space for compassion so we can rethink about the necessary tools and resources that we need to bring into our spaces to better help our employees.
Thank you. Dr. Marshall, do you have one additional comment to add to that?
Yeah, I'll
Great.
add, just kind of reiterate, and I'm just going to continue in that thought. When I think about, just as I mentioned about hearing the voices of clients, and we also need to hear the voices of our employees and people who work within our organizations. And a lot of times in many different organizations I worked in, things don't shift or change, or we don't make any changes until we listen to the voices of all people who work, which is a part of being inclusive, is hearing and listening to voices from all people, and not just leadership making decisions that they think will impact others. And I'll even go as far as to say that, and I don't know how other people may feel, but you know, there are people who love working from home, and then there are people like me who working from home has probably been even more depressing. Not being around people, being a person who is an interpersonal person who are inspired by bouncing ideas off of people in an in-person setting, functioning better when I'm able to interact with people. It has probably been a little more challenging for me, but because I have the smile and get work done, and maybe do things all great and wonderful, and people think that all his happy-go-lucky self is just wonderful and great. I actually hate being in the box of the Zoom. I wish we could be having this conversation in person. And so I think that the advice that I would give to the leaders of nonprofit corporations, education, government sectors, for the individuals who are working home, remote, and hybrid, is that the first thing you need to do is take a poll to see if the tools that you all have in place to address an inclusive and healthy workplace, find out if what you already have in place, if you feel like it's effective or not. Getting some feedback from those employees. And when you get that feedback from your employees, don't just let that sit somewhere and say, oh yeah, we did this, we heard your voice, and not do nothing. Hear the voices, and then we need to take some action. What are some things that we're going to change in our policies? What are some things that we're going to change in our practices? What are some things that we can incorporate and add into our workspace to accommodate those who are not here in the office, those who are working from home? Because there may be challenges that we don't know about. There may be things that are happening at home that we don't see within the box, that might be happening, that may be detrimental to their health. We don't know what type of work environment our staff are living in at home. We don't know if someone is in an abusive situation. We don't know if someone may be in a point where they just feel like giving up in a way that they feel like giving up, and may need that support from your leadership. And so I think that the most important thing is taking that poll, doing an assessment of where your employees are, and also putting it into some actionable items. I see show empathy and support. Yes, I love this. Let me stop there because I'll keep going. I think you got a sense of what my answer is.
Yes, absolutely. We're going to actually take, this is a great segue into our next section. I want to highlight what Sharon Barker is doing in their organization. They created a charging station room. It has gliders, snacks, music, coloring books, and an atmosphere for people to go and recharge. And it's and Sharon also added that, you know, it was well received, and Sharon actually thanked the CEO for allowing it. And I will tell you, those are the things that matter. I remember working back in the ages of 1999, where I was at Nabisco, and we had the same thing. In Nabisco, we had a think room, and it was filled with candy, and another room was filled with pillows and music, because we had, as creatives on the brand management team, we had to be able to go and just detox all that stuff, everything from data to focus groups and everything else. So this stuff is important. It takes us back to Ashley's point, where she said, get back to the foundation, get back to the basics. And Dr. Marshall has told us we got to really remember our people. So in remembering our people, we're going to remember that you need a 5-minute break right now. It is exactly 11:45, and we're going to ask you to come back at 11:50. And this part you do not want to miss. We are talking about toxic stress and emotional tax, and we're going to use a example called the bystander breakout, where you will be broken out into groups and will be taken on this journey by Dr. Marshall and Ashley Brooks James. So this is where you get to apply a lot of the work. So I thank you all for being here. We'll see you in 5. This is awesome. I really appreciate both of you. So Dr. Marshall, I'm going to go ahead and turn it over to you and Ashley. And you've got control. Thank you. And just let me know about the breakouts when we're going to do that, and I'll break everybody out.
Okay. Well, before we go into the actual work, I just wanted to bring some attention when we talk about, we talked a lot about like creating spaces, hearing the voices of the people within. And I think it's important for, you know, both White America and BIPOC to understand the language that comes with it. I feel like for White America, it is crucial for you to understand some of the phrases I'm going to share with you here in a minute, so you can identify some of the things to help you on your journey on this anti-racism work, right? And for us in the BIPOC community, I think it's important to have this language to help us identify when things are happening to us, right? And so there's a common language now that is shared, so both parties understand first what's happening, what's going on. And so we can, you know, either, you know, on one side, again, help us on the anti-racism work, help us be aware and intentional of the things that are being done. And then we can, on the BIPOC side, we can identify the harm, right? And so when I talk about this, and this is in your workbook, and what I will say is I'm not going to take the time to go through, and we're not going to identify, you know, the words or anything like that. There's a couple that I do want us to take some time to kind of speak on. But all of you have the workbook. It's a full workbook. You can work through it on your time. But chapter 2, you will see it's breaking down white supremacy culture. And basically what we've done in this particular section of the workbook is highlighted some of the words that some of us are becoming common language for us. And so on your own time, you know, one of the homework assignments is to fill out, you know, what each word on the left mean to you in your own words. I will send Dawn a follow-up when she sends a follow-up email with the full definitions. But again, this is kind of like a little like to take afterward that you can do. Also, there's an additional journaling exercise. You can write about experiences that you've had with each word, or perhaps you've had, you know, participated in them. So make sure you take some time in that area as well. But before we get to the third action, I do want to identify some of the words that I feel like are important when we specifically in the health and wellness space. And the first one that I want to bring attention to is spiritual bypassing. And at this moment, if anybody wants to drop in the chat or share, you know, what they feel this definition may mean, or if they want to maybe share something that happened to them before I kind of go into that. And if not, that's okay as well. So the reason why I want to bring attention to this is I'm going to read this and you'll have this, but spiritual bypassing, using tactics commonly associated with wellness and toxic positivity to bypass the actual needs of the BIPOC community. It often comes with suggestions like, just be positive. You're so beautiful, amazing, talented. Don't be sad. Everything happens for a reason, or no bad days. To ignore the realities of BIPOC in the country and the world. I feel like this happens a lot. as we talk about coming off of post-pandemic, I mentioned earlier, that compassion piece, right? I've had a lot of clients that I work with when, we kind of have open forums, a lot of those things come up. I've been telling my stories, and then, someone from the opposite race tells me, oh, you're so beautiful, you're so smart, you're so intelligent, and kind of bypassed my needs and hearing my voice. And so I think when I think of this, I've even tried to be mindful of, because we all can, whether you're white, black, or whatever, we all can kind of get caught into this space of, I know me growing up, I heard just, we're gonna pray about it a lot, right? Like I had a whole conversation with Bishop Walker on a panel about this. So we like, so those are some of the things. But what I wanted to bring emphasis on, I think during these times, when people are really trying to have their voices heard, the first thing that we can do is, number one, is just listen. Open up a space to just be intentional and just to listen without trying to fix a situation, just being there. I think I've gotten really good at responding in the way of, how can I best support you in this moment? And I think when we rephrase, we all want everything to be great, right? We want to be butterflies and unicorns, and we want to tell you love and light, but not love and light is not always appropriate at every time. So when we think about our responses to people's mental health or trauma, I think, we have to be very careful on that spiritual bypassing piece of it. Brian, did you want to add something? I thought I saw your lips move. Okay, all right. So I wanted to bring attention to that. As we go into this bystander breakout session, I think it's important to also identify white silence. And I'll read this. Not speaking up because you're afraid. White silence is, it's not a passive act, it's a violent one. It's why we're either racist or anti-racist. We are either actively participating in it and defeating from the system, or we are working to dismantle it. And so when we go into this bystander breakout, I think we're going to really hit on the importance of being silent, and how silent can be very, very harmful and very traumatizing. And I think that it's important as a BIPOC community, if we are connected to someone of the opposite race, that we are able to call the people that we are connected to in. My business partner is a white woman. Last year, over the last 2 years, we've had to have a lot of hard conversations, a lot of life-changing conversations. And I bring this up because at some times we've also had to do check-ins, because life continues, and it's easy for the opposite to go on about their lives when things are happening to us every day. And I think it's important that we do those check-in and being is my silence, am I using my voice in a way that can help, or is my silence harming the people around me? So I want to bring this to action step number 3. Pay attention to how these words show up in your work, in your life moving forward. Once you know what they are, you'll be likely to notice them and when they're happening more often. So I think that I saw a lot going on in the chat, and because I've been talking, I haven't been able to keep up. But I think this is, I just wanted to bring this to the table, because I feel like in order for us to actively do this work, we have to all have common language that we're using. So Brian, if you wanted to add anything, or if you want to take us right in to the next portion.
Absolutely. Thank you so much. Let me get my screen here, share 1 second. All right, thank you so much for that introduction into this conversation today that we're gonna be having about really becoming the active bystander. And I'm so glad that you talked about that white silence, because I think that is going to kind of steer into the direction of that I think this conversation is going. As we were coming up with what to talk about for today and thinking about ways that we as a whole community can help each other advance around increasing wellness and justice for all people, I thought about how powerful our voices are. And I thought about, you know, how words and actions and all these things have so much power to change and shift a narrative. And I also thought about, you know, the idea of white people, you know, who we consider as a majority. And if we talk about, you know, racism, then there's a level of power and authority, these words that are associated with our white community. And I often wondered how many times in different spaces, in different organizations and workspaces that the people who are here working in have witnessed and seen things happen within their workspace, or seeing things happen even outside of the workspace that they know is wrong, that they know needs to be addressed, and don't say anything. And what does that silence? What does that silence mean? Is that silence mean I'm complicit? Is that silence more of a, oh, you know, this is how things always been, and you know, it is what it is? Is that silence, I just don't know what to say, but I know something's wrong? Or is that silence, I don't see anything wrong with what happened? And you know, the Center for Nonprofit and many different organizations, we've had multiple conversations, you know, about, you know, racism, bias, microaggressions. So I'm not even going to bore you with going through talking about bias, because I think that we all collectively, and I can't see the chat right now, so I hope that everybody does know racism and know what bias is, understand what microaggressions are, and how they are used in different kind of ways that we need to address. And if not, then we need to go back to the drawing board down and maybe have some more conversations to make sure that we are ensuring that everybody knows examples of what that looks like. But I'm just going to assume that, you know, all of us wonderful human beings know when we see something, know when we hear something, that it may not feel right or that something is wrong, and know that you may have the inkling to speak up or say something, knowing that your voice may be powerful in that change, can do something. So let's get into this, because you know, everybody knows I'll ramble and go on and I'll get off script. So let me just stay on script and read my notes, okay? So community conversations, becoming the active bystander. You know, sometimes, again, there's a situation that just doesn't feel right. It may be a comment that be made by a friend, which also puts you in an uncomfortable situation. If you have a friend who says something, hey, let me back up a little bit. There are conversations that happen, not even in front of the person that is intended to offend. There may be conversations that behind closed doors, we sit at the dinner table that we're having with our family members. There may be conversations when we're just out with our friends in our comfortable space away from people that we may be having, or someone may have, or someone may say something about some other people. What does a bystander even look like in a situation when it's just you and the people you're comfortable with, and you hear them say something about somebody? I think a lot about my work. I'm working in LGBTQ health and people who are allies, or who say that they're allies. And I think I talked to Mary, talked about this during the last session, where, you know, they'll say they're ally, they'll show up to events, to show up to things, but when they're around certain people behind closed doors, away from the parades and away from those meetings where you show up and say, I'm an ally, and you hear other people say things that you know are inappropriate, that you know can offend. How do you use your voice in those moments to correct someone for something, a thought that they may say in private, but may also say that same thought in public, or maybe the way they act or some microaggression that they may use or some kind of way that they treat people would affect someone. And so we know that there may be comments made by friends, whether it's in private or in person, or in a workspace or wherever, in public, whereas it's inappropriate and you spot someone maybe even being harassed. But particularly being an active bystander means that you are aware when someone's behavior is inappropriate or threatening, and you choose to challenge it. And if you do not feel comfortable doing this directly, there are also opportunities where you can go to someone to get help, such as someone in authority. However, when we talk about authority, the authority may be the ones who are the perpetrator of those microaggressions or of those racist comments or those discriminatory comments. And so how do we even address people in authority? And, research has shown that interventions, different bystander interventions, and there are several different ones. And Don, please remind me to send some of those interventions to you that we can send out to individuals. But it showed that bystander interventions can be effective ways of stopping explicit and harmful acts before it even happens. And so being a bystander, which I use as using your voice, using your powerful voice, to me, where the direction I think we're going is I think it's going to be helpful in bridging this entire, all these conversations that we've been having, or these series of conversations, and how we use our voice in a powerful way. Let's see here. So active bystander, again, by definition, is someone who not only witnesses a situation, but also takes those necessary steps to intervene or address the situation in a way that prevents further escalation of issue or harm to a victim. And I just want to kind of stop here and make sure that I just, clearly describe what victim may be in many different ways. And so victim could be employee to employee. So employee being the one who is the aggressor in the situation, or the one who is actively emitting those microaggressions or those discriminatory thoughts or actions, or making someone feel uncomfortable, if we would, by putting their biases into a situation. It also can be a client to employee, just depending on where you work. I know my sister, she used to work for a nursing home, and there were many nursing home patients who told my sister, my Black sister, they were white patients who said, you can't be my nurse, because you're Black, and requested to have another nurse come in to service them when my sister was assigned to them. And so what does that even look like? As an employee, as another coworker who would witness another coworker have a patient tell them that you can't be my nurse because you're Black, and go give me a white nurse. And I think my sister even told me one time that a white nurse was like, well, she asked for a white nurse, so let me just go and let me just take care of it, and then don't worry about it. I wonder how that made my sister feel for her employee to tell her to don't worry about it. What does that say? That her employee wouldn't speak up for her. That moment when it was a client to employee situation. Of course, it can be employees to clients. We as we check our own biases, there may be things that you may experience from your employee on how they treat different clients differently, or how they treat patients differently. And so there are many different instances where we can activate our powerful voices and being an active bystander. Let me move along. And Don, just give me a look. If I'm going over time, just give me a look, because I like to talk. Okay, so just
So we got about 2 more minutes. So
2 more minutes.
And their breakouts. Yes.
2 more minutes. So what I'm gonna do is I'm gonna go here, because this is what I want you all to take in your breakout session. And Don, what we can do for the breakout, I would love to put maybe like 5 in each group. But I want you to consider these 5, what is called known as the 5 Ds, which is direct, delegate, distract, display discomfort, and delay. And I'm going to describe these really, really briefly, because this is what I want you to take into your breakout session shortly. So directly address the perpetrator, which is the person who is doing the act that we know is making someone feel uncomfortable, and consider a unique approach to addressing that person. Distract could be diffusing the situation by shifting the focus of the perpetrator to prevent further harm. So diffusing the situation. So you may be a situation where you see something happening, you may need to step in and say something maybe in that moment. Delegate, this is what I want everybody to concentrate on as well. I know I'm going out of order, but delegate, reporting this incident to someone who you think may be more equipped or better able to discuss the situation with the individual. Display discomfort will be one of those things where, like if somebody says something that makes you feel uncomfortable, that it's not right, instead of laughing it off, ha ha ha, that they will see even in your face or in your expression that what they're doing is not right, displaying that discomfort. And delay, perhaps you need to take a step back and it's just assess the situation a little further to make sure that what you see is actually what you see. And what I want to do, and if you can type in, because I'm not on my screen, just type in direct, distract, delegate, display discomfort, and delay. I want you all in your groups to think about a time where you may have witnessed a situation at your job where you saw something that wasn't right. And let's just say, for instance, nobody spoke up in that moment. How can we incorporate these 5 Ds into a situation? So you all can talk through some things and maybe come up with an example that you all collectively want to address. And then I want you all to take these 5 Ds and tell me how you can incorporate these 5 Ds into your own situations that come up in your focus, in your breakout groups. And so, Don, how many minutes can we give them? What are we looking at like on time?
We can give each group about 7 minutes.
Okay.
And we've got the breakout groups ready to go. And I will make sure you have these 5 things in here. So can you give them the directions one more time so we can all hear them again?
Correct. So when you go in, maybe someone, if someone goes in and they already have a scenario that they know that they want to talk about, from experience they may have seen in their workplace where they know that they could have used their voice to address that issue. Just have someone go ahead and give that scenario, and then you all describe, or maybe pick up a different person to say how we would have, directly addressed the situation, how we would have distracted from the situation by, or delegate, the situation by going to someone and, someone higher in a position that can address the situation better. How we can delay the situation by maybe taking a look back and maybe assessing what has happened to see how we need to address the situation. And so you may not remember all of the Ds, but I just want to hear, some of your thoughts on how you can navigate through a situation when you see something happen and how you can use your voice. And so let's take 7 minutes and let's do that and come back and see what we come up with.
All right, I'm opening rooms right now. Thank you so much, Dr. Marshall. I will drop these 5 Ds in each room. We'll see you shortly. And you just click the word join. We'll see you on the other side. Moderators, you are in as well.
I'm gonna jump in through different ones to see.
Okay. Yes, absolutely.
How they're going. Okay.
And I'm gonna pause the recording for the big room. Go ahead. Welcome back, amazing people. I was in every room and there were so many yummy conversations. So I'm going to turn it back over to Dr. Marshall and let him have y'all report out.
Dawn.
Yes.
Excuse me. I'm sorry. Terry was saying something really important during our meeting, and I was just getting my first sentence, and I really want to finish what I had to say.
Okay. What I will do is send you back for about 3 minutes. Does that work? Though, if you want to go back, you can go back. So what we're going to ask is that you be prepared to report out. We're going to ask that you be lean in your expression, have 1 minute, talk about the scenario, what you found out, and advice from your group. Okay. So I'm going to send you all back.
I love this. It's such a rich discussion.
Yes, it was. All right, so we'll pause again.
Awesome.
Welcome back, everyone. Did everyone get everything done in the 4 groups? Are we good? All right, Dr. Marshall, it's on you.
All right, well, I'm ready to listen and learn. So we'll just, if somebody want to go ahead and step on in and be our fearless leader in this conversation, this powerful conversation, and using our powerful voices. Let's go.
Which group would like to go first? We have 4 minutes.
I can
Okay.
share
Okay.
what we talked about. So my name is Ray Ruth. I work at Nurses for Newborns and I use she, her pronouns. I was sharing a story about I recently joined a recreational volleyball league. So not at work, but I was at the first game and a bunch of people had shared, had dinner beforehand. So they had all met each other and I didn't have a chance to go to dinner. So I just went to the game and met them there. And when I got there, I was talking to a woman, just introducing myself. And then another man came over and he was like introducing himself and then said, oh, what was I supposed to ask her? There was something that he was like, we were like talking about something at dinner that I was supposed to ask everyone else. And then they were all like, I don't know, I don't remember. And then he looks at me and he was like, oh, I was supposed to ask you your pronouns, and then just started laughing. And so I was like super taken aback. And I think I displayed discomfort and I showed in my face that I was not okay with that reaction to that question. But then immediately it was like, oh, we got to go warm up, like we're going to play. And so I just said, oh, what a good question. And then didn't have a chance to, and in my mind, I was like, I want to say I use she, her pronouns, but didn't really have a chance to express that. So I didn't really use the bystander, the things that you sent out, but we were just talking about this situation and, kind of thinking through how I can work through it, potentially address it in the future, but it's a challenging one.
Yeah. Thank you for sharing. All right, who's next? Yeah. Let's go. Come on, Jeannie.
It's Jeannie, yeah, like
Jeannie,
I dream
yeah.
of. So I was talking about a moment when I was in, I want to say some kind of Zoom chat like this, and I work for a nonprofit, and one of the people was a donor, and one of the things the guy said was, he was a white man, and he said, yeah, there's no scholarships available for my son's demographic. And like you said, Ray Ruth, like my face definitely expressed like, but this is a person that I have to kind of cater to, like he's in a position to give my organization money or not give my organization money, or, whatever that power structure could be for anyone. And so we were talking about what do you do in that kind of situation? My face will never not display discomfort. I can't help it. So other than that, we wanted to hear y'all's take on this.
Yes, it almost sounds like a situation where a delay, where you maybe had to just take a minute and just process the situation.
Delay forever.
Well, I have a question.
Yes.
What is his son's demographic? Are we talking about just a young white boy, or does he have some handicaps or some other special circumstances?
No, he just meant white male.
Then he was feeling rather entitled. And I would have told him that he was showing his privilege and his entitlement, and that there's a reason why there are not scholarships for white men. I'm sorry, but I'm not sorry.
Yeah, thank you for that response. And I think what happens as we think through these 5 Ds is, what does that power structure look like? And so this, as she said, this person's positioned to give them money. So how do we address that when this person has seemingly this position of power that will benefit our organization? What do we do then?
Well, I think you have to represent the whole organization, though. And if he was wrong, I would tactfully have let him know that he was wrong. Because morally and ethically, you were wrong, and you're representing my organization, and that's not what my organization stands for. So with or without your money, I need you to know that you were wrong. Maybe I would have said something to let him know tactfully, again, professionally, that he was wrong and we need to have a conversation about it on the sidelines, but it would have been addressed.
Yeah. Thank you for that. And thank you, Jeannie, for that answer. Who's next? These are good. Y'all, we can have these conversations for hours. But yes,
Absolutely.
Who's next? I see Sarah.
So I kind of have two, and wanted to share a little bit of both. I'll go as quick as possible. I work for the Hybrid Lifeline Peer Project in the state of Tennessee, and we help people get into treatment and make referrals to recovery resources, and are in the community talking about stigma and helping reduce stigma around addiction. And one thing is, in a couple of weeks, I'm going to be going to Atlanta to the National RX Summit and presenting there about what we do. And one of our somebody in leadership, a male, asked us to do that in a delayed way after he asked all of our male counterparts to do that first. And when he asked us to do that, he said, do it, but talk about how you do it as women. And I was very direct with him and let him know that I don't understand why it was important that it is important to me that I'm a woman, but the way that he presented that to me, I was like, why do I have to include that part? What is important is the work that I am doing. And I let him know, that we knew that we were his last choice to present, but we were the ones who got it done for him. But my second example is, in my work, I get a lot of referrals from justice involved individuals and probation officers and attorneys. And I always look at my data every month to see, what population can I talk to and reach out to, and where am I lacking? And one thing that I've noticed, and this has been really helpful for me in my work, and I would welcome any advice, is I've noticed that my referrals for Hispanic and African American populations are down in my area in very rural West Tennessee. And I've been reaching out to that and to people in my community about, why is that? Why am I seeing more referrals for white women and men? What is the reason? And I haven't liked some of the answers that I have gotten, but I want to know why. And I want to be able to touch that community as much as I can. And so if you all have any advice to offer me, I'm totally open to that.
First of all, you just gave a whole different perspective of what a bystander looks like. And, as we've been talking about it in the instance of an action that has happened that we can see. You're talking about something you observed just looking at, data, internal data, and how we can be a bystander when we see internal data and stats within the realm of our work that we know are not right. Even when we look at the stats and data for the high rates of many different health disparities for minoritized groups and the work that we do with our own organization, we see these numbers and we see who are at the top of the list for different things. How are we using our voice to say, are our interventions, are the things that we're doing actually helping people? What can we do differently? What policies can be changed? What interventions can we implement into our organization is actually going to shift the narrative of those who we see are highly impacted by whatever they may be impacted by? What can we do to address that? Instead of just learning and reading about certain things, what you're saying is, I took an action to see, I noticed, I read something that was alarming to me. And now my actionable item is, now we need to have some conversations about it. Thank you for that.
And I want to add, this is so funny, Dr. Marshall, boy, she was, woo, you talk about triggered. So I've spent the last 15 years in the same space, and I actually built an entire statewide program that does reentry. So here's what I did. I'm going to give you my lived experience. What I did, just like Terry said, the data doesn't lie. I collected the data from and I'm still badged. I still got my badge. I'm actually going to the prison on Monday, but I'm still badged. So what I do is I bring them their data. So I gave them the numbers, 65% to 70% of a particular facility may be, and a lot of times is, minority. But every referral that comes out of the case management's office happens to be a white male or a white female. So I take that data back to them and say, hey, and I actually track it down to the person. So I got people's TDOC. I know when they're getting out, all that good stuff. So I'm like, why is Jim on my list and not Michael and John? And so when you show them that data, and I actually did this at the TDOC, so I go to the department and talk to the deputies and all those good people, because they are open and they do not really get to see the data like you do. So what I had to do was get my reports together. So when I went into those big meetings, they were like, oh, all of our people come home with IDs. I had the very exact thing that you were saying. Everybody that was Black and Hispanic and Native that were being released from a certain jail and prison in the state of Tennessee, none of the people of color came out with IDs. All of my white men came out with IDs. And so when you go and present the data to them, they were like, oh no, we're sending the ID. I was like, no, I talked to Lisa. Lisa told me that she found the paperwork, charged the man that's on his card, but he does not have his ID. He's sitting in front of me right now. Would you like to talk to him? So again, if you need some other things and ideas, and I can share with you some of the resources that I've used across the state, my information is in there, dawn@cnm.org. I am willing to help you. And we also have a justice involved conversation that's coming up in a couple of weeks. So definitely want to invite you to come in and say some things.
Yes, thank you so much.
Absolutely.
All right, do we have any other, did we miss anybody?
We have, I think, 2 more groups.
2 more, yeah.
So our group was group 4. And I was with Cicely and Ashley. My name is Terry. I work with CNM, and really enjoying this conversation. I shared an incident that happened in a meeting at CNM last fall that escalated to a point where I don't want to go into like too much detail, but one of the Black participants was harmed by another participant who both were not on staff, and there were 3 of us on staff. It escalated very quickly, and the person that was harmed left. It was a Zoom meeting, left, and I hadn't said anything, and neither had my staff. And again, I'm looking at the 5 Ds and thinking, gosh, Brian, where were you before that? Because I didn't feel equipped, and it was hard to process what was really happening in as it. So yes, I was a bystander, and I, have replayed it over in my head a million times, wishing I had done one of these Ds. And I talked in my group about saying, I think what I needed to do was the distract D, that I could have, the argument was off topic. I could have said, let's hold that, but let's get back to why we're really here. And maybe it wouldn't have escalated. And then Cicely said some very powerful, gave me some very powerful feedback. And she said, that distract sounds, I don't know. I don't remember what word you used, Cicely, weak or something like that. You needed to be direct. And I'm like, yeah. And I didn't know how to do it. So today is really important. And the ripple effect of that incident, though, has actually caused us to do our work very differently at CNM. We have done a lot more training with our adjunct facilitators and consultants in the equity space. Dawn has been hugely helpful in making sure that happens. So it was a terrible thing, and we learned a lot from it, and we are better in a funny way. I think, I don't want to say we're better because of it, but our journey has continued. We learned from it. Thank you, Dawn. Those are the words. We learned from it. So I don't know, Ashley or Cicely, if you want to tell more about our group, but I'll stop talking.
No, Terry, thank you so much for sharing that. That was, I really enjoyed Cicely's feedback. I think that I wish everybody could have heard it. Matter of fact, I wish that when she said I needed to talk, she just kind of gave that, because I feel like we all could just learn from being direct when we feel weak in a situation or we feel discomfort, right? One of the things that I wanted to bring to the table, like, this work is not, obviously we're talking about work and how we better our environments and work, but I shared the importance of taking this work into our families, right? Like, Brian, you had talked about, being a true ally for, LGBTQIA community. And I couldn't help but to think about my family internally, right? And how not all of us are on the same page, right? And I use the frame old school thinking, you know, from my father and some of my uncles, you know, but also having the courage to be direct when you see that coming from people that are, you know, your fathers, your uncles, the people who raised you, but having the voice to carry that into our family lives, right? Like, we're not just being advocates and allies at work, but this is our lives. And we have to be dedicated both in and outside of work and bringing awareness no matter who it is. So Brian, thank you for, you know, saying that, because that was one that really struck with me. Like, you know, I have tried to break through the barriers of being afraid to use my voice to people who are, you know, older than me and my family, to support a community that I feel that I am a true ally in. So I wanted to say that.
Excellent. Thank you so very much. I know we're coming on our, this is perfect. How did we end the space? Was there another group that needed to report out? Did we get all four? I think we got all four. Yes.
Do we?
I think we did. So Ashley Brooke James and Brian Marshall, we're going to end with you two. I know Ashley's going to close us out, but if we could have some final words and some things that we need to move forward, the path forward, Dr. Marshall, we'll start with you.
Yeah, because I'm gonna actually end us with a good wellness quote or something to help us send us on our way. But you know, first we know that I'm glad, and I didn't know when we were planning this that this topic would be, you know, such a interesting topic. I just knew that I felt like in my spirit that we have to start using our voices more when we see injustices happening. And we can't be scared to use our voices, because that's how we push it, especially those of us who know we have a place of privilege and power. And that's it. And I'll just put a pin here. There may be different conversations to have. The privilege and power isn't always with the white face. Sometimes privilege and power can be with the black face as well. And so when you're in a position of privilege and power, use your voice, because your voice is powerful. Your voice can evoke change. And know that, you know, although this is a short period of time where we, you know, had this conversation, we really just want to plant the seed. And so we hope to have further conversation around this. And I hope that there was something that was said today that would ignite something that you can take back to your own jobs, your own families, your own friends, your own community, about different ways that we can work together, because it's really about us working together. And so on that note, Ashley, I want to leave it to you to give us our good final spiritual thought.
And Ashley, before look, can I get a shameless plug for an activity that we have just based on what Dr. Marshall's talked about? Last week or earlier this week, we were able to embark on a journey in equity and inclusion, and talked about groundwaters through the Racial Equity Institute, had some training on the 14th of next week. Even if you did not get to attend the first session of groundwaters training, which is all this work and the work that Brian's talking about in the bystander piece, we will have a conversation digging into, you know, those real things we are seeing in our lives. So Brian, I want to invite you and Ashley to come through on next week, where we are just talking specifically about what's going on in your space, Danny and Cicely and Ray Ruth, where we will take these and actually put some work around it. And we'll be sitting in community together, dealing with all of these things. So I'll put that in the chat. And Ashley, I am done. It's over to you. Thank you.
Well, thank you all. Thank you all so much for allowing Brian and I to amplify our voice in this space. Brian, it has been an honor to share this platform with you again. I do want us to, before I'm gonna do a meditation to take us out, but I do want to say this. When we think about our wellness, you know, it doesn't always come in the form of food or movement, but community. This right here, this conversation is a part of our well-being. When we think about our mental well-being, community is such a big part of that. Y'all know what it was like the past 2 years when our communities were stripped from us. That was a part of a lot of the darkness that we carried around within us. So I want you to know that, like, I always think of wellness as primary and secondary food. Our primary food is conversations like this, you know, being with our loved ones, finding joy outside of, you know, food, right? Like the things that fill our soul. And conversations like this, I know personally for me, it fills my soul, and I can see due to the chat, it fills everybody else's soul. And those secondary foods is, you know, the actual food that you eat and water intake that you do. So I just want you to redefine wellness for yourself. Know that it doesn't have to look like what the world has put out there for us, but redefine it for yourself, and know that community is a big part of that. And with that said, I just want everybody just to sit back in your chair, just get comfortable, close your eyes, just take a moment, just this moment for yourself. Scanning the body from the soles of our feet to the crown of our head, from the crown of our head to the soles of our feet. Take a big, beautiful inhale in through the nose. Side out. Again, big, beautiful inhale in, fill up the lungs, the chest like a balloon with air. And exhale, side out. We're going to inhale for 1, 2, 3, and hold. Exhale, 4, 3, 2, 1. Take a big, beautiful inhale in through the nose. And exhale, side out. Again, scanning the body, bringing that attention to the soles of the feet, relaxing the feet, relaxing the toes. Letting go of any tension in the legs, the knees. The thighs melt into our chairs. Again, we're breathing into the belly, to the ribs, to the chest, and hold. Exhale. The back, the shoulders, arms, wrists, hands, and fingers, all soft. The neck, the throat is soft and relaxed. The face is relaxed. The mind is relaxed. The body is relaxed. Again, we breathe in, belly, ribs, chest, and hold. Exhale, chest, ribs, belly. Bringing our right hand to our heart and our left hand on top. Just take a moment to honor yourself for creating space for your mental well-being, for dedicating time to community. We also, in this moment, we thank the creators of this land and this practice of yoga and meditation. Together, we take our last, biggest, fullest inhale in, holding at the top. Exhale. Let it go. The light in me recognizes and honors the light in each and every one of you, and I thank you for your time and your energy in this space. Be well, my friends, and thank you.
Wow. Thank you so much, Ashley Brooke James, Dr. Brian Marshall. This is awesome. Please drop the yoga business in the chat. Someone wants to know. Absolutely, absolutely. We got your information there, Brian. If you want to drop it again, I did put my mashup in there, but there may be some other ways that people can connect. We want to thank all of you on behalf of the Center for Nonprofit Management here in Nashville, Tennessee, where we amplify the voices and the work of nonprofits around this beautiful city and state. We thank you for being here. We thank you for staying the course, and we want to encourage you to go and be an active bystander. This information has been recorded and will be sent to you via email. If you have any questions or concerns or did not get a chance to sign up and got here by another way, please send me an email at dawn@cnm.org and we'll make sure you get added. Enjoy the rest of your day, folks. We're going to give you 5 minutes. Thanks again so much, Triluna. Thank you, Brother Mashup. And the work that y'all are doing is amazing. You'll see these two again.
Yes.
We have community conversations. Come and join us all. All right. Thanks again.
Thank you,
Thank
Don.
you. Thank you, Don, so
Bye,
much
everyone.
for always. Yes.
Yes.
Thank you.